Knock, knock. I'm watching my hands. My name is Megan. I'm a family nurse practitioner student with United States University. Can I have your name, please?
Lee,
And when's your birthday?
January 23rd, 1987.
So we're here to do a neurological exam today. Do I have your consent to record this interaction and upload it to YouTube for my professor and classmates to view?
Yes.
All right, perfect. And I'm going to do a room scan. These are my tools. Okay. So to begin, I am assessing his level of consciousness. He's alert right now. And I'm going to assess his orientation. So, once again, tell me your name.
Lee,
What's my name?
Meg,
Okay. And then, where are we right now?
Hammond, Louisiana,
All right. And what is the month and year?
November 2023.
Okay. And what are we here for today?
An exam.
Good. So, that is person, place, time, and situation. Um, they're intact, and his speech is clear and fluent. So the next thing that I will do is assess his recent and remote memory. So for recent memory, what did you have for breakfast this morning?
Biscuit.
Okay, you did have a biscuit for breakfast this morning. I can verify that. And what did you do for your anniversary last year?
I went to a country concert.
Yes, he did. I was there. So that's correct. And then I'm gonna assess his reasoning and judgment. So if you were driving down the side of the road and you saw someone unconscious laying on the road, what would you do?
I'd call 911.
That's an appropriate answer. So appropriate reasoning and judgment are intact. The next thing that we will assess is his cranial nerves. So the first cranial nerve is olfactory. So I have two scents. I'm going to test one nostril at a time. So can you close your eyes and include your right nostril? And what do you smell?
Peanut butter.
Wonderful. And then close your eyes and include your left nostril. What do you smell?
Vinegar.
Beautiful. So his cranial nerve 1 olfactory is intact. Next we'll do cranial nerve 2, which is the optic nerve. We do visual acuity and visual fields by confrontation, and that's the static finger wiggle test. And we do a fundoscopic exam. So with visual acuity, I have my Snellen chart. This would be, if this was on the wall, he'd be 20 feet away. I'm holding it for a handheld chart. He's 6 feet away. So can you close your right eye? And with your left eye, what is the lowest line you can read?
CFDHJ.
All right. And you don't have any contacts in?
No, I don't.
So in his left eye, he is 20/25 uncorrected. And close your left eye. With your right eye, what's the lowest line you can read?
CFDHJ.
Okay, in his right eye, he's also 20/25 uncorrected. And with both eyes, what's the lowest line you can read?
CFDHJ.
Okay, so with both eyes, his right eye and his left eye, he is 20/25 every time. So next we'll do the static finger wiggle test to assess his visual fields by confrontation. So cover up your right eye, please, and tell me when you can see my fingers come into view wiggling.
Now.
And that's about lateral, even with the level of his ear, so that's normal. Again.
Now.
And one more time.
Now.
Okay, so it's intact in every field there. Close your left eye. Let's do that again.
Now.
Okay.
Now. Now.
Okay, and then It's the same findings in the right eye as the left eye. He can start to visualize my fingers when they are about laterally to the level of his ears. And then with both eyes open.
Now. Now. Now.
Okay, we have the same findings for that. So his so far he's intact with his optic nerve. The last thing I'm going to do for this part is the fundoscopic exam. So with the device in my left hand, I'm going to inspect his left eye. Going to brace myself for safety and then move in at a 15-degree angle. For starters, I can see his red reflex, that's intact. And then moving in closer, I see his optic disc. The margins are sharp and clear. Disc to cup ratio is 3:1. Cup to disc is 1:3. I can see the macula and fovea, and his vessels were the arteries and veins were overlapping appropriately. No AV nicking, cotton wool spots, or retinal hemorrhages. I'm going to move on to do the right eye with my right hand. Brace for safety. Let's see. Moving in at a 15-degree angle. I can see his red reflex. And then I see the same thing, optic disc, sharp margins. Disc to cup ratio is 3:1. Cup to disc 1:3. The macula and the fovea I can visualize, and then his arteries and veins overlap appropriately. No AV nicking, cotton wool spots, or retinal hemorrhages. So his optic cranial nerve 2 is intact. Next, we'll do his oculomotor cranial nerve 3. So the first thing I'm going to start off by doing is pupillary reflexes and accommodation. So I'm going to shine my pen light into his left pupil, and I see it constricting from a 5mm to a 3mm directly. And then the right eye also constricts consensually when I do that. And I'm going to shine it into the right eye. It constricts from a 5 to a 3 appropriately directly. And then the left eye constricts consensually, which is also appropriate. Then I'm going to do accommodation. So if you look at my pen light here, look over my shoulder at the AC unit. When he looks over my shoulder, his pupils dilate, and then look back at my pen, and they constrict appropriately. And he can even do cross-eyed tests, so that's intact. And then the next part of this is going to be extraocular motions. So we actually usually test 3, 4, and 6 oculomotor, trochlear, and abducens together. So I'll show you which part each is. So close your right eye first, and then follow my finger up. This is testing oculomotor 3, and then lateral testing abducens 6, and then oculomotor 3. So those are intact. There's no nystagmus. And then moving inward and down, that's testing trochlear, cranial nerve 4. So then cover up your left eye and follow my finger. So testing oculomotor cranial nerve 3, abducens cranial nerve 6, oculomotor cranial nerve 3, and trochlear cranial nerve 4. And back up, and they're all, there's no nystagmus. They're all intact. And then you could just, if you want, with both your eyes, abducens, oculomotor. All right, so his cranial nerve 3, 4, and 6 are intact. We're gonna do, we did 3 and 4. I'll do 5. That is trigeminal. To test trigeminal on, I'm gonna take something. It's a broken off Q-tip, has a sharp end and a dull end. I'm gonna touch 3 spots on either side of his face. So close your eyes and tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull.
All right, and then you can open your eyes, and can you clench your jaw, please, really hard? Okay, and then open your jaw against my resistance. So it's strong, and that tests the motor part. Another part that we test that we could do for trigeminal nerve is to take a cotton wisp and just wisp it across his cornea. It would test corneal sensation, but we're not going to do it for this video. So we did 5, we did 6. 7 is going to be the facial nerve. So you can make an excited face, raise your eyebrows, and then make a mad face, and then puff out your cheeks. Okay, so facial nerve is intact as evidenced by equal and symmetric and strong facial movements in the upper and lower part of his face. Oh, that's 7. 8 is going to be vestibulocochlear or acoustic. To do this, we'll do the whisper test and the Ryan-Weber. So I'm going to go behind you and over here on your left side, I'm going to whisper a word. Tell me what I whispered. Baseball.
Baseball.
Okay. And then over here,
Soccer.
okay. So whisper test, he passed. And then with my tuning fork, I'm going to do the Weber test and the Ryan test. With the Weber test, I'm going to put it on the front of his forehead bone. He should hear it equally in both sides. So tell me where you can hear it.
Both sides.
And is one side greater than the other or equal?
Equal.
All right. And so intact Weber test. Now we'll do the Ryan test. I'm going to strike it and put it on his left mastoid bone. Tell me when you stop hearing it.
No.
And can you still hear it?
Yes.
Okay, that's normal. Bone conduction is longer. Air conduction is greater than bone conduction. So he stops hearing bone conduction first, and he can still hear air conduction. I'm going to come over here now, and I'll do the same thing on the right side. Tell me when you stop hearing it.
Now.
Okay, can you still hear it?
Yes.
Okay, so normal findings there. Air conduction was longer than bone conduction. So his acoustic or vestibulocochlear cranial nerve 8 is intact. 9, I'm going to assess with 10 by having you open your mouth and stick out your tongue. Say ah. Okay, so I see his uvula raise, his soft palate moves as well when he says ah. And when he sticks out his tongue, it's midline. I could also do a gag reflex here, but I'm not going to do that. So 9 is glossopharyngeal and 10 is vagus. Both of those are intact. 11 is spinal accessory muscles. So raise your shoulders and against light resistance on both sides. He's got equal 5 out of 5 strength. And then turn your head against my hand and then against over here. So that was testing his sternocleidomastoid muscle on both sides. It's intact. So his accessory nerve, cranial nerve 11 is intact. And then 12 is hypoglossal. So stick out your tongue, and it's midline, there's no drift, and then you can put it back in your mouth. And then press your tongue against your cheek here, and then press your tongue against your cheek here. And it's equally strong on both sides against resistance. So hypoglossal cranial nerve 12 is intact. The next thing that we're going to assess is his cerebellum. So the first thing that I'll have you do is stand up and just walk normally over to that side of the room. I'm assessing his gait. His regular gait, he's unassisted. There's no ataxia, no swaying. He's not tripping, not losing his balance. Now you can walk with one foot in front of the other to me. And this is assessing a tandem walk. And he's doing a great job, no loss of balance. You could stop. And then walk. Well, you could walk to me on your toes, on your tippy toes. Good, no loss of balance, unassisted. And then go back and come back to me on your heels. Walking on his heels, unassisted, no loss of balance, no ataxia. Smooth, so that's intact. Now, we'll test pronator drift. So stand with both of your feet together and hold out the pizza box with your hands up. Good job. And close your eyes. And I would have him stand here for 30 seconds, making sure that neither of his arms drifts. And I can also do light resistance, both his arms. are strong, equally 5 out of 5 bilateral, and they both pop right back up after I stop putting resistance on him. He's not swaying, he's not losing his balance. So pronator drift test is good. You can open your eyes again. Then you can sit back down, and I'm gonna do a test. I'll have you touch your nose and then touch my finger, and then touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. All right, and so he does that with no problems. So his cerebellum seems to be intact. The next thing that I will assess is his sensations. So first, I'm gonna do a 2-point discrimination test. So on his upper and lower extremities, I will touch him with either 2 sharp ends or 1, and I want him to tell me if he feels 1 or 2. I'm gonna kind of just put your sleeve up so that you can feel. All right. So close your eyes. Do you feel 1 or 2?
2.
Okay. Do you feel 1 or 2?
2.
Okay, that's correct. And then on the other, close your eyes. Feel 1 or 2?
1.
1 or 2. Okay. And you can put your sleeve down. Close your eyes again. Left lower extremity. Do you feel 1 or 2?
2.
1 or 2?
2.
Okay. And up here, 1 or 2?
1.
And down here, 1 or 2?
1.
Okay. So sensations intact with the 2-point discrimination. Next, I will do a graphesthesia test. So in your palm, in his right palm, close your eyes. I'm going to draw a number in your hand. Tell me which number I drew.
8.
Good job. And then give me the left hand. Which number did I draw?
1.
Okay, good job. And then I will do a vibration test. So put your hands on your knees, and I'm gonna strike the tuning fork and put this on a digit and tell me which digit I have it on. Close your eyes.
Middle finger.
Which hand?
Left hand.
Okay, so that's the, I'm doing the distal interphalangeal joints. So that was correct. And where do you feel over here?
Right ring finger.
Okay.
Left big toe.
Okay.
Right big toe.
Okay. I'm gonna do the joint position sense test in all of his fingers and toes. So actually scoot over a little bit towards me with your chair because we can't see your toes. That's better. Okay. So put your hand on your knees, and I'll have you close your eyes. I'm gonna move your fingers either up or down. Tell me which direction I'm moving them in.
Up. Down. Up. Up. Down. Up. Up. Down. Up. Down.
Okay.
Up. Down. Up. Down. Up. Down. Up. Down. Up. Down.
Okay. So he got all those correct. And then the last part of that is I'm gonna do a sensation test to see if he can test sharp or dull. So close your eyes, and the sharp side is the side of the Q-tip that's broken, and then the dull side is the actual Q-tip part. So do you feel sharp or dull?
Sharp.
Okay.
Dull. Dull. Sharp. 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 Dull. Dull.
Okay. So his tactile sensations intact. So sensory, he's intact. Next we will do motor. And to do this, I'm gonna test his deltoids, biceps, triceps, his fingers, his hand strength, his quadriceps, hamstrings, and hips. So kind of make like a chicken wing, and I'm gonna press down and try to resist me. Okay, so he's equally strong on both deltoids, and then hold out your hands like this, and I'm gonna press down, try to resist me. All right, so 5 out of 5 strength to bilateral deltoids, equal and smooth. And then I'm gonna have you do like this, and I will try to pull out, so resist me. Bicep strength is 5 out of 5 bilaterally, and then I'm gonna try to push you in, resist me. Tricep strength is 5 out of 5 bilaterally. Squeeze my hands as tight as you can. All right, so 5 out of 5 hand grip strength bilaterally, and then with both your hands, I'm gonna have him abduct his fingers, so spread them apart, and I'm gonna try to push him in, but resist me. All right, and then close them and try to spread them apart and resist me. All right, so his abduction and adduction to bilateral hands and fingers is intact, 5 out of 5 strength. So to test his quadriceps, going to have you try to kick your leg out and then resist me. All right, and then resist me over here. So 5 out of 5 equal quadricep strength. And then to test his hamstrings, try to pull your leg in. And try to pull your leg in. All right, so 5 out of 5 equal strength there for hamstrings. And then for your hips, I'm going to try to push them together and you try to abduct them. Good job. And then try to adduct them or push them together. Good. So 5 out of 5 strength bilaterally equals equal hip strength, abduction and adduction. And that concludes everything for motor. And then last I'm going to do his reflexes. So I'll do a bicep reflex in both arms. I'm going to put my thumb on his bicep and strike. And he's got a good +2 reflex. And then on the other one so that was the left. I'll do the right now. Okay, good reflex. And then I'll do the right tricep, just relax. Okay, good reflex, +2 over there on the right, and then tricep reflex over here. Good, +2 reflex on the left tricep, and then I'm going to do his patellar on the right. All right, that was +2 reflex intact on the right, his patellar. And on the left, same findings. Then I'm going to do his Achilles reflex on the right. All right, and that was intact. And then his Achilles reflex on the left. All right, and that's intact. And then I'm going to hold up your feet, and this is going to tickle. I'm testing the Babinski reflex by dragging the pointy part of my reflex hammer along his feet. His toes should curl. Oh, they do, sorry. Okay, and then we're intact on the left, and then on the right, yes, the toes curl, intact, normal reflex, Babinski on the left, the left and the right. And that is going to conclude my neurological exam. Thank you very much.